The new healthcare law, there was a lot in that law, and you probably all saw the pictures that people put out of the actual document being, this tall. So there's a lot of detail, and what I'm going to try to do is just touch on 4 main points that if I was speaking to my parents or grandparents on Medicare, I would want them to understand how it impacted Medicare. So the 4 key changes to Medicare that everyone should be aware of as a result of the new healthcare law are these. 1, is there going to be lower costs for drug coverage as a result of the new law. 2, you now have access to free preventive services. The 3rd is there are some changes to Medicare Advantage plans that everyone should be aware of. And 4, there were some changes made to make the program more efficient so we can make it last over time. Who's hungry for donuts? Nice donut, huh? So the reason I have a picture of a donut up there, I'm sure many of you can guess, is there is one huge flaw in the Medicare program. There's a gap in coverage for Medicare Part D drug coverage. It's called the donut hole because how it works, and you're probably very familiar with this, is that you are covered up to a certain amount of drug coverage. And then if you exceed that amount, you fall into the gap known as the donut hole, and you have to keep paying your Part D premium, but you have no coverage for prescription drugs. And then if you spend a lot on prescription drugs, you then fall into catastrophic care for Part D, and you continue to get your drugs covered. So this is a really challenging issue for a lot of people because it tends to hit people when they're really sick, they're taking a lot of medication, then all of a sudden they're not covered and they have the financial stress on top of the stress of being ill. How many of you have known someone who's fallen into the donut hole? It's extremely stressful. So one of the major reasons why AARP chose to endorse the new healthcare law, the Affordable Care Act, was that the new law calls for closing the Part D donut hole over time. It will be completely closed by the year 2020. And as of this year, people who fall into the donut hole will receive a 50% discount on brand name drugs and a 7% discount on generic drugs. Those discounts will grow over time so that at the point in the future, there will be no more gap in coverage. So that's a major provision that everyone should know about. The second point I want you to remember about the new healthcare law is that Congress realized that it's smart to encourage people to get preventive services. So you can catch problems early through a mammogram or a colonoscopy or other cancer screening while it's still treatable. And if you catch things earlier, it's also less expensive to treat them. So as a result, what they did in the new law is to get rid of all co-pays for preventive screenings. And they also, the deductibles do not apply to these. So as of just this year, you can go to your doctor, get any of these types of screenings, and you're also eligible for an annual wellness visit under Medicare, which is new. So encourage everyone to take advantage of this and get your preventive health care needs met. The third point I'll cover are Medicare Advantage plans. So in essence, there are two big choices in Medicare that you can choose from. You can choose regular Medicare, which means you get your Medicare card and you take it to any provider who accepts Medicare. Or you can sign up for a private insurance plan known as a Medicare Advantage plan. And if you do that, you agree to stay within their network of providers. So a couple things happened in terms of changing the way these Advantage plans work that I want to make people aware of. Well, first of all, let me say that most people, we have 900,000 people in the state on Medicare. Only 200,000 are on Medicare Advantage plans. So most people have just regular Medicare, original Medicare as it's known. But for Medicare Advantage, it's sort of an accident of history, the way Congress set these plans up. Congress is currently paying Medicare Advantage plans 14% more on average. So if you're on Medicare Advantage, Gary, and the Medicare program spends 14% more on Gary than he would spend on, say, you in the orange jacket if you were on regular Medicare. So these are called subsidies or overpayments, and Congress put them in place to encourage Medicare Advantage plans to get into the market, but it's extremely wasteful to have this extra spending with no accountability tied to what they provide for those extra payments. So what Congress did is say, let's level the playing field, even out reimbursement between Medicare Advantage and regular Medicare over time to save a lot of money and make the Medicare program last into the future. The second thing they did is institute some consumer protections for how these Advantage plans work. For example, some of these Advantage plans in the small print you may not notice when you sign up have very, very high copays for certain services, such as cancer treatment or kidney dialysis. So the new law says you can't do that anymore. The copay that you charge for those services has to be consistent and the same as what people would pay under original regular Medicare. The third point is it limits the amount that these plans can spend on administrative costs and profit and such. So they have to spend 85 cents out of every dollar actually on your care and not on these other things. So that just summarizes the range of changes to Medicare Advantage plans. So the final point is they did a couple of different things to basically extend the solvency of the Medicare Trust Fund so that it will be there over time. The first is reducing waste, such as the changes in reimbursement to Medicare Advantage plans I already talked about. The second is a whole host of changes to improve our healthcare delivery system. George sort of touched on this in his introduction, that we have a very inefficient healthcare system in America, and the new healthcare law is encouraging preventive care, encouraging doctors to work with each other and to coordinate your care more effectively, and encouraging new models such as accountable care organizations, which provide the financial incentives for your providers to work as a team instead of not communicating with each other. So several provisions in there to improve the way we receive health care. And the final is seriously cracking down on fraud and abuse within Medicare. There are phony providers out there who are billing Medicare for services they've never provided. And that's wasting billions of dollars for the Medicare program. So the new healthcare law invests in cracking down on that kind of fraud and abuse. And the result of all those changes together is the new law extended the life of the trust fund for Medicare by more than a decade.